Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
Carpal tunnel syndrome is a painful condition of the hand and fingers. Over the past few decades, it's been on a very sharp rise in the United States and worldwide. The major contributors to your getting carpal tunnel syndrome are genetics, your occupation, pregnancy, the shape of your wrist, your overall health, and, as more recent studies show, the amount of sexual activity you have. The link between the incidence of carpal tunnel syndrome and the amount of sexual activity may not seem apparent at first, but a major medical report states that the overall increase in the incidence of carpal tunnel syndrome can be due to sexual activity, because sexual activity is the most widely practiced activity that vigorously uses both hands at the same time. Other studies strongly support this position, so if you have carpal tunnel syndrome, it's important to understand what it's caused by and how you can treat it. Carpal tunnel syndrome is actually a disease that begins deep inside the wrist in an area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective and lasting, it must solve the problem of swelling inside your carpal tunnel, and not just mask the pain it causes. If you're one of the millions of people who have carpal tunnel syndrome, it's important to know that you don't need surgery to get rid of your pain and other symptoms. In fact, studies show that the vast majority of people who have carpal tunnel surgery didn't need it in the first place. Instead, deep tissue massage should be used, which is nearly 100% effective in getting rid of carpal tunnel syndrome. But this isn't your everyday massage. It requires specific motions over the forearm to drain the fluid inside the carpal tunnel and to break adhesions over the tendons that cause inflammation. And to be effective, it has to be performed twice daily and for 2 to 4 weeks. But you don't have to visit a therapist every day to get this treatment, because the Carpal Rx will do it for you. The Carpal Rx automatically produces deep tissue massage, which acts on the tendons, causing them to lose their inflammation. Surgery doesn't address this inflammation, which is why it fails so often, and why the Carpal Rx is so successful. It comes with a true 100% guarantee because it targets inflammation. The Carpal Rx always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.